Ensuring seamless continuity of care across healthcare settings. Understanding continuity of care. Continuity of care represents a comprehensive process that ensures consistent and seamless patient care across different healthcare settings and providers. Definition: the process of ensuring consistent patient care across different healthcare settings and providers. Purpose: improves patient safety and health outcomes while reducing hospital readmissions. Benefits: enhances communication between providers and increases patient satisfaction. Foundation: built on coordinated information sharing and collaborative care planning. Key components of continuity. 3 essential components work together to create effective continuity of care for all patients. Information continuity. Accurate and timely sharing of patient information between providers. Complete documentation of treatments, medications, and patient responses. Effective communication of patient preferences and care goals. Management continuity. Coordination of services to ensure appropriate care delivery. Seamless transitions between different levels of care. Consistent implementation of treatment plans across settings. Relational continuity. Ongoing patient-provider relationships that build trust and familiarity. Consistent care team members when possible. Respect for patient preferences and cultural considerations. Healthcare team members in continuity. Various healthcare professionals contribute to effective continuity of care coordination and implementation. Primary team members. Registered nurse, RN leads care coordination and discharge planning processes. Licensed practical nurse, LPN provides hands-on care and communicates patient needs effectively. Unlicensed assistive personnel, UAP assists with daily activities and basic care needs. Physician/nurse practitioner, directs medical treatment plans and makes clinical decisions. Support team members. Social worker/case manager, assists with discharge planning and community resources. Pharmacist, ensures medication reconciliation and provides patient education. Physical/occupational therapists, provide specialized rehabilitation services. Effective handoffs and shift reports. Proper handoff procedures ensure that critical patient information transfers accurately between healthcare providers. Purpose of handoffs. Reduces medical errors through comprehensive information sharing. Provides complete picture of patient's current condition and needs. Enhances team collaboration and coordinated care delivery. Ensures continuity when care responsibility transfers. Best practices for shift reports. Be concise but thorough in information sharing. Report objective data including vital signs, lab results, and medication changes. Include patient concerns and identified safety risks. Ask clarifying questions before accepting care responsibility. Follow facility policies for handoff procedures consistently. SBAR communication method. The SBAR method provides a structured approach for effective communication during care transitions. SBAR framework. Situation: what is currently happening with the patient? Background: what is the relevant patient history and context? Assessment: what do you think is the primary problem? Recommendation: what action should be taken next? Practical example. Situation: Mr. Jones is experiencing increased shortness of breath. Background: he has a history of COPD and was admitted for pneumonia. Assessment: his oxygen saturation is dropping despite current therapy. Recommendation: I recommend increasing oxygen support and notifying the physician. Care transitions between settings. Successful transitions require careful planning and coordination to ensure patient safety and continuity. Common care transitions. Hospital to rehabilitation center or skilled nursing facility. Nursing home to home care with family support. Primary care provider to specialist consultation. Emergency department to inpatient hospital unit. Inpatient care to outpatient follow-up services. Essential considerations. Schedule necessary follow-up appointments before discharge. Provide required medical equipment and prescription medications. Educate patients and caregivers about post-discharge care requirements. Coordinate with community resources and support services. Discharge planning process. Effective discharge planning begins early in the hospital stay and involves multiple disciplines working together. Systematic discharge planning steps. Assess patient needs, determine medical, social, and functional requirements for safe discharge. Develop comprehensive care plan, include medications, therapies, and follow-up care arrangements. Provide patient and family education, teach medication management, symptom recognition, and activity restrictions. Coordinate community resources, arrange home health services, support groups, or financial assistance. Schedule follow-up appointments, ensure continuity with primary providers and specialists. Medication reconciliation. Medication reconciliation prevents dangerous drug interactions and ensures accurate medication management across care settings. Medication reconciliation process. Verify current medications, obtain accurate list of all medications patient is taking. Compare with new orders, check for discrepancies between existing and new prescriptions. Clarify any discrepancies, resolve conflicts or unclear medication instructions. Educate the patient, explain any changes in medication regimen and proper administration. Safety benefits. Prevents dangerous drug interactions and duplicate medications. Reduces medication errors during care transitions. Improves patient understanding of treatment regimen. Patient and caregiver education. Comprehensive education prepares patients and families for successful self-care after discharge from healthcare facilities. Essential education topics. Medication instructions including dosages, timing, and side effects. Symptoms requiring immediate medical attention. Activity restrictions and gradual return to normal activities. Dietary recommendations and nutritional requirements. Follow-up care plans and appointment scheduling. Teach-back method. Have patients repeat instructions in their own words. Clarify any misunderstandings before discharge. Provide written instructions to reinforce verbal education. Ensure patients feel confident about self-care abilities. Overcoming barriers to continuity. Several common barriers can interfere with effective continuity of care, but practical solutions exist. Common barriers. Poor communication between healthcare providers. Lack of patient understanding regarding discharge instructions. Insufficient resources for follow-up care and support. Limited access to healthcare services in community. Effective solutions. Use electronic health records to ensure information sharing. Provide clear, written instructions that patients can understand. Arrange home health services when patients need additional support. Encourage family involvement in care planning and implementation. The LPN's role in continuity. Licensed practical nurses play essential roles in ensuring effective continuity of care across all healthcare settings. Key responsibilities. Observe and document, monitor patient progress and report significant changes. Communicate clearly, provide thorough shift reports using SBAR format. Advocate for patients, ensure proper discharge education and necessary resources. Follow established protocols, adhere to facility guidelines for care transitions. Support patient education, reinforce teaching and answer patient questions. Summary and professional impact. Continuity of care ensures seamless transitions across healthcare settings through effective communication and coordination. The SBR method provides structure for shift reports and handoffs, while discharge planning and medication reconciliation reduce readmissions and complications. Patient and caregiver education improves outcomes, and licensed practical nurses play vital roles in coordinating care and ensuring patient safety throughout all transitions. Key takeaways for practice. Effective communication prevents errors and improves outcomes. Patient education is essential for successful discharge transitions. Medication reconciliation protects patient safety. Professional collaboration benefits all patients and families. Thank you for learning about continuity of care. Your commitment to seamless care transitions makes a significant difference in patient outcomes and recovery success.